Good afternoon, everybody, or should I say good morning. My name's Dr. Brooklyn Storm, and I'm all psyched up to be able to talk with you this morning about some of the signs and symptoms of anxiety. So let me just get my chair organised here. How are you all going? Good, I hope. Okay, so generally speaking, the signs and symptoms of anxiety can be broken down into three areas, and the first one of those is physiological. The physiological signs and symptoms can include things such as nausea, butterflies, breathing difficulty. Some people might get headaches. Hey Taylor, how you going? Other people might experience perspiring or excessive perspiration. You can also feel trembling in your hands and feet. Good morning, Eric. How are you? Thank you very much for joining. So the physiological symptoms vary from person to person, and what often happens is when we have a clinical diagnosis of anxiety, it doesn't mean that we experience all of these symptoms all of the time. Good morning, Frank. How are you? Thanks for joining. Good morning, Geraldine. Thank you very much for joining. But what we do know is that when people are experiencing an exacerbation of their stress or an exacerbation of their anxiety, that's when these symptoms become intensified and they tend to escalate. So what you can find is learning how to be self-aware of the onset of anxiety can be a really great way for you to have an early intervention and apply some of those tools and techniques that your psychologist has taught you so that you can pull back the overall intensity of those feelings. The second family of signs and symptoms is cognitive. So the word cognitive just means the way we think about things. So our thinking can become quite distorted when we're experiencing anxiety. As you guys know, I've sort of mentioned before that my interpretation of anxiety is that it's future-based thinking. When we're worrying about things that haven't happened yet, that might happen, that could happen, that should happen, we don't know how life is going to look like on the other side of some event that perhaps is coming up. So what happens is when we have trouble with anxiety, what we can often find is we have difficulty making a decision. Perhaps we start to second guess ourselves. We have self-doubt. Maybe for some people it might be affecting them on a day-to-day basis. Perhaps their partner asks them to go to the supermarket and go and get milk, and they go to the supermarket and there's a whole great big wall of milk. They can have full fat, low fat, almond milk, skim milk. My goodness, they just get overwhelmed by all the different types of milk, and they come out without any milk at all. So it can really affect your ability to make simple decisions that you would normally make without thinking, even more challenging. The other thing that anxiety can do is it can really disrupt your ability to remember things. So you can become quite forgetful. You might be driving to work and wonder if you turned the stove off or if you remember to lock the front door and things like that. So another way is with planning and organising. So maybe you have some event to plan. It might be a barbecue on the weekend or something like that, but all of a sudden this just seems too overwhelming. Things like that can be symptoms of anxiety that are what we call cognitive. Good morning, Shani. How are you going? I hope you're doing really well. Just talking a little bit about anxiety. So the last sort of component of anxiety of these three that we're talking about this morning is behaviours. So behavioural symptoms can include things like avoidance. So avoiding the trigger or the area or the thing that it is that brings about the anxiety. But it can go further than that, and it can look like perhaps things like agreeing to see a girlfriend perhaps and then bailing on her on the last minute because you just get so overwhelmed by your anxiety that you don't want to go. It can include perhaps avoidance of the workplace, so we see an increase in absenteeism and things like that. We might also see people becoming quite irritable. One of the signs of anxiety too is your sleep gets affected. Some people just experience really racing thoughts. They have a lot of trouble turning their brains off when they're going to sleep at night. So they don't get a deep sleep. They don't feel refreshed. They wake up in a mood, you know, grumpy or cranky, or, you know, it doesn't take them very much at all to be triggered for the day. And so there are a whole lot of behavioural symptoms that can come along with feeling anxious as well. But, you know, the good news is that, good morning, Michael, how are you? The good news is that, you know, according to the latest data that's out by Beyond Blue and by the Australian Bureau of Statistics and linked in with all the Medicare mental health care plans, is that we know that approximately 75 to 85% of people who are diagnosed with anxiety do get well. And well can mean learning how to manage a condition, or it can mean a condition resolving when they have combined treatment. And combined treatment can be a combination of things like monitoring by your GP on a regular basis, as well as attending counselling with your psychologist on a regular basis. For some people, they might also need some medication, and that's fine. You've just got to remember that if you're taking medication, you really need to be taking it consistently and being very mindful of taking other substances, whether they're prescribed or not, because of course they can be contraindicated and actually work against the medication that you're taking. And what happens then is some people experience an intensification of the very symptoms that they're trying so hard to, you know, remedy. So I hope you've enjoyed this video this morning on signs and symptoms of anxiety. On Thursday, I'll pop back at 11 and I'm going to talk with you about assessment. So how do we know when we've actually got it? What's involved in assessing somebody with anxiety? What does a diagnosis mean? And next steps. So if you have any questions, of course, this is a live stream, and I love it if we're really interactive. So if you have a question, of course, jump on and ask, or a comment, you're most welcome. Otherwise, you can send me a private message anytime. My name is Dr. Brooklyn Storm. I'm the director and the head psychologist at All Psyched Up in Frankston. And yeah, we're here to help. So if you need anything anytime, just give us a call. I hope you have a really lovely day, everybody. Bye.